Welcome to Eastern Circle Incorporated Monthly Educational Health Corner. This month, we focus on men's health awareness, highlighting important topics that impact the lives of men in our families and neighborhoods. In this session, we'll cover hypertension, heart disease, and prostate health. Join us as we raise awareness, promote prevention, and empower men to take charge of their health. Presented by Eastern Circle Incorporated, advocating for health promotion, disease prevention, and chronic disease management for adults 18 years and older. Men, let's begin this discussion. How do you stay healthy? As you know, some health problems like high blood pressure and heart disease happen more often in men. High blood pressure, about 50% of men have high blood pressure. Gets more common as you get older. Age 18 to 39, 23% of males have high blood pressure. 40 to 59, 52% of men have high blood pressure. And age 60 years and older, 72% of males have high blood pressure. Let's look at race and high blood pressure. Black men, 58% have high blood pressure. White men, 50%. Asian men, 46%. And Hispanic men, 44%. How to help manage blood pressure? Eat healthier, exercise, drink less alcohol, and don't smoke. And if you do have high blood pressure, please contact your medical doctor or provider for counseling and advice of management. Now let me talk a little on enlarged prostate. This affects 45% of men over 45 years old, up to 80% of male over 70 years. By race, you have white men 34%, Black men 30%, Asian men 32%, and Hispanic men 24%. Enlarged prostate often comes with high blood pressure, obesity, that's overweight, diabetes, and trouble with erections. How to help? Regular visits to your doctor, your primary care doctors, your nurse practitioners, and healthy living and seeking medical advice. Heart disease, in male, you get 1 in 5 deaths. That is 20% of male die from heart disease. The death rate per 100,000 male, Black men, 246 deaths per 100,000. White male, 299 deaths per 100,000 male. The risk of heart disease, high blood pressure, cholesterol, high cholesterol, smoking, diabetes, obesity. How to help this? Get your regular checkup with your doctor. Know your risk factors. Know your family history. Eat healthy. Avoid foods high in cholesterol, high in fat, high protein, high sugar. Exercise and no smoking. Men, no smoking. This will decrease your risk of dying from heart disease. So, here are some healthy lifestyle tips, gentlemen. Exercise. Exercise 150 minutes per week. That is 30 minutes per day. Exercise you can do such as running, jogging, swimming, basketball playing, football playing, soccer playing, strength training 2 times a week. You can do that also by swimming. You strengthen your muscles, lifting weights only 2 times a week. Gentlemen, you can do that. You can. I know you can. Recommended foods, fruits, vegetables, whole grains, lean meats, fish, nuts, low-fat dairy products. Drink less alcohol, no tobacco smoking. And for those of you that do smoke, help is there. Have a conversation with your provider. Call the hotline. There are so many different guidelines to help you, medications to help you to stop smoking or to decrease the amount of tobacco that you smoke daily. Do your regular health screenings, such as know your blood pressure, check your blood pressure, know your numbers. It's important. If you have diabetes, your blood pressure should be less than 130 over 80. If you have high blood pressure, it should be, and no diabetes, it should be less than 140 over 90. Know your numbers. Cholesterol levels should be less than 200. Your total cholesterol, less than 200. Your LDL, which is the bad cholesterol, should be less than 100. And your HDL should be high. That's the only thing in cholesterol that we want to see high. Everything else low. Blood glucose, know your blood glucose levels. Ask your doctor. If you're diabetic, you should know what is your normal pulse after you eat, and know what is your fasting levels. Do your prostate check annually. Speak to your doctor. Once you're 40 years and older, you should be getting your prostate checked. Know your family risk factors. Know your genetic makeup. Know who in your family had prostate cancer, colon cancer, the different cancers. So you could have that conversation with your provider. You can do it. We are here. Eastern Circle Incorporated are here to help you and guide you. You have any questions? Our aim is to help you to prevent diseases, to promote your health, and to manage chronic diseases. Because we know you can. We can do it with help. So men, we are advising you to please take care of your health. See your doctors. Healthy lifestyle. Know your numbers. Know your blood pressure. Know your sugar levels. Know your cholesterol levels. Know your prostate levels. As we come to the end of this topic, this is our references. If you want to get more in-depth information, please visit these sites. Thank you for tuning in once again to Eastern Circle Incorporated Health Point. We hope that our monthly educational information helps raise health awareness. See you next month. Our website, www.easterncircleinc.org. Phone number, 1-800-901-5104. If you have any questions, you can call us. Thank you for watching, and thank you for participating in this monthly event. See you next month.